Hello everyone. This video is on glycogen storage diseases. So in this video we'll be seeing how to easily learn and memorize these glycogen storage diseases. Now these are a group of inherited diseases that are characterized by deficient mobilization of glycogen or deposition of abnormal forms of glycogen, causing liver damage and muscle weakness or sometimes early death. In some of the glycogen storage diseases, early death can also occur. Now glycogen, from where is glycogen synthesized and where does glycogen metabolism primarily take place? It takes place in two main organs, one is the liver and the other one is the muscle. The organelle in which glycogen metabolism is taking place is in the cytoplasm. So some of the glycogen can be engulfed by the lysosomes, wherein degradation of glycogen can take place in the lysosomes using an enzyme acid maltase. Okay, using an enzyme acid maltase. Now in the liver and muscle are the two main organs in which the glycogen metabolism is taking place. So in liver, both glycogen synthesis, yes, and glycogen breakdown can occur, as well as in muscle glycogenolysis and glycogen synthesis. Both of these pathways occur both in the liver and the muscle. Now let's see the various enzymes which are involved in it. So in the liver, the glycogenolysis, what are the different enzymes which take part in glycogenolysis? They are liver glycogen phosphorylase, debranching enzyme, and glucose 6 phosphatase. Yes, so what happens when these enzymes are deficient? Now liver ends with VER, right? So the deficiency of liver glycogen phosphorylase can lead to Her's disease. Her's disease, and since it ends with S, it is type 6. It is type 6 glycogen storage disease, right? And debranching enzyme. So debranching enzyme, there is D. So the disease which is caused due to the deficiency of debranching enzyme will be Cory's disease. Okay, CD, right? So Cory's disease, and Cory rhymes with 3. So it is type 3 glycogen storage disease. And glucose 6 phosphatase, hope you all know this. Glucose 6 phosphatase, it is type 1 glycogen storage disease. So 1 goes or rhymes with von. So it is von Geerk's, which is type 1 glycogen storage disease that is due to glucose 6 phosphatase deficiency. Right. Now, whenever there is defective glycogenolysis, what is the significance of this pathway? The significance of this pathway is that it gives blood glucose levels. It elevates blood glucose levels. So liver glycogen's breakdown contributes to blood glucose level. So what if these enzymes are defective? It can lead to hypoglycemia. Is it? It can lead to hypoglycemia because it can't contribute to blood glucose level because of these enzyme deficiencies. So it can lead to hypoglycemia. Also, these glycogen or abnormal glycogen can accumulate in the liver, which can lead to hepatomegaly, right? It can lead to hepatomegaly. Now let's see in the other set of enzymes. Now the synthesis, glycogen synthesis takes place in liver and muscle, and the enzymes are glycogen synthase. So the deficiency of glycogen synthase can lead to type 0 glycogen storage disease. And the other enzyme is branching enzyme. Branching enzyme, the deficiency of branching enzyme can lead to B goes with A. It is Anderson. Okay, it is Anderson. Anderson is nothing but type 4 glycogen storage disease. Okay, so we've already seen CD, now AB, right? So what is that CD? CD is nothing but Cory's disease caused by debranching enzyme. and Anderson's disease caused by deficient branching enzyme. So this is the A, B, C, D of the glycogen storage diseases. Yes. Cori is type 3, Anderson is type 4. Right. Now let's look into the next set of enzymes. So glycogenolysis or glycogen breakdown, which is happening in the muscle. What are the enzymes involved in it? It is muscle glycogen phosphorylase. So in liver we had seen liver glycogen phosphorylase. In muscle it is muscle glycogen phosphorylase. Deficiency of muscle glycogen phosphorylase can lead to McArdle's disease. McArdle's disease. So M for M. Okay. McArdle's disease. Now McArdle's disease is type 5. Type 5. Liver glycogen disease, glycogen phosphorylase, the deficiency can lead to Her's disease, which is type 6. Right. So type 5 is McArdle's, which is due to deficient muscle glycogen phosphorylase. Next is debranching enzyme. So the same way in liver, debranching enzyme can lead to what? What we have seen? C, right? Cori type 3 and Cori due to debranching enzyme. Similarly, the same disease, which is Cori's type 3, right? So these are the various glycogen storage disorders, right? So in liver, what can it lead to? Liver glycogen phosphorylase can cause Her's disease, which is type 6 glycogen storage disease. The debranching enzyme deficiency, C, D, Cori, rhymes with 3, so it is type 3 glycogen storage disease. And glucose 6 phosphatase deficiency can lead to von Geer's type 1. 1 rhymes with von, right? Next is defective enzymes of glycogen synthesis. The main enzyme is branching enzyme. Branching enzyme B goes with A. So Anderson's, which is type 4, is due to deficient branching enzyme. So what is the ABCD? Anderson for defective branching enzyme, Cori's due to defective debranching enzyme, right? So what happens when glycogen synthesis is defective? Glycogen synthesis is defective, what can happen? And due to mainly branching enzyme, if it is defective, what can happen? There can be few glycogen with fewer branches, right? So it can also be called as amylopectinosis. Okay, it can also be called as amylopectinosis because there is fewer branches. So this abnormal glycogen can also get accumulated in the liver, which can lead to hepatomegaly, also in the muscle, which can lead to muscle hypotonia, right? Hypotonia. Can it cause hypoglycemia? No, it cannot cause hypoglycemia because glycogenolysis, if it is defective, only can cause hypoglycemia. So glycogen synthesis is only defective, so this does not cause hypoglycemia. So what are the symptoms whenever glycogen synthesis is defective? It is muscle hypotonia and hepatomegaly because it is defective both in the liver and the muscle. Yes. Now in muscle glycogenolysis, if it is defective, what happens? When muscle glycogen lysis is defective, muscle glycogen phosphorylase is defective, which leads to McArdle's, and a debranching enzyme, which can lead to Cori's, right? And what will be the main symptom here? It is exercise intolerance. It is exercise intolerance. So exercise intolerance happens in defective glycogenolysis in muscle. So can glucose 6 phosphatase enzyme present in muscle? It is not present in muscle. It is present only in the liver. This is why muscle glycogen cannot donate blood glucose, whereas liver glycogen can donate blood glucose, right? Now if you see, Cori's disease is due to debranching enzyme, and the debranching enzyme is present both in liver and the muscle. So Cory's disease will have both hypoglycemia symptoms and exercise intolerance. Yes, both hypoglycemia symptoms and exercise intolerance. Whereas Her's disease, von Geerk's disease, presents with hypoglycemia and hepatomegaly only, whereas Cory's disease has both hypoglycemia and exercise intolerance. McArdle's disease, because it is present in muscle, it presents with exercise intolerance, right? And branching enzyme, because it is a enzyme of glycogen synthesis, there is no hypoglycemia, yes, and there is no exercise intolerance here. There is muscle hypotonia, okay, there is muscle hypotonia and hepatomegaly, yes, and hepatomegaly. So hope you have understood, hope it is easy for you to memorize the features, the enzyme deficiencies of various glycogen storage diseases. Now let's see, I had told you the glycogen, some of the glycogen can be taken up by the lysosomes where it can get broken down, and the enzyme necessary is acid maltase, okay, acid maltase, which is nothing but alpha 1,4 alpha 1,6 glucosidase enzyme, okay, alpha 1,4 alpha 1,6 glucosidase enzyme. So what if this acid maltase is defective? If acid maltase is defective, we can also call it as lysosomal storage disease. Okay, so what can happen? Glycogen will not be broken down, so glycogen will get stored in the lysosomes. So there is accumulation of glycogen in the lysosomes, leading to Pompey's disease, So Pompey's disease is type 2 glycogen storage disease. And how do you differentiate Pompey's disease with the other disorders? There is accumulation of glycogen in lysosomes in various organs like heart and other organs. Okay, heart, liver, muscle. So what can happen? Cardiac, along with the other symptoms, there is involvement of heart. So there is cardiac involvement in case of Pompey's disease. So whenever you get a case, when you suspect glycogen storage disease with cardiac involvement, then it is definitely Pompey's disease, right? Also there is muscle involvement leading to muscle hypotonia, right? And the onset is very early, and there is also death due to heart failure by an early age, at the age of 2. So there is muscle hypotonia, there is cardiac involvement. Cardiac involvement is the most important one here. Understood? So the deficiency of acid maltase can lead to Pompey's disease. The next disease is Taroway's disease. Taroway's disease is due to deficiency of phosphofructokinase 1. Is this an enzyme of glycogen metabolism? No, it is an enzyme of glycolysis. Yes, it is an enzyme of glycolysis. Then why have we classified it under glycogen storage disease? Because phosphofructokinase 1, if it is deficient, what happens? All of the glucose 6-phosphate will be directed towards glycogen metabolism. And this phosphofructokinase is present in muscle and RBCs. So you will have manifestations of muscle and RBCs. RBCs, it can be hemolytic anemia. So whenever there is glycolytic enzyme deficiency, there will be hemolytic anemia, which is definitely for sure, right? And in muscle, when it is deficient, it can lead to exercise intolerance. Okay, it can lead to exercise intolerance. And also there can be low blood lactate levels because there is defective glycolysis in the RBCs. So hemolytic anemia and exercise intolerance, which is Taroway's disease. It's due to deficiency of phosphofructokinase 1. So now let's see what are the disorders, what are the glycogen storage disorders that can lead to hypoglycemia. It can lead to hypoglycemia. It is Her's disease, Cory's disease, von Geerk's disease. Do you agree? Yes. And what are the disorders which can lead to, which will not lead to hypoglycemia or exercise intolerance, but instead there is hypoglycemia and muscle hypotonia? It is Anderson. Okay. Now, what are the diseases which can lead to exercise intolerance? It is McArdle's and Cory's. Now, what are the glycogen storage diseases which can lead to both hypoglycemia and exercise intolerance? It is Cory's. Yes, now do you understand? And what is a glycogen storage disease which can lead to hemolytic anemia? Hemolytic anemia, it is Taruvie's disease, right? But it does not cause hypoglycemia. Instead, it causes exercise intolerance. Exercise intolerance. And what causes cardiac involvement? The glycogen storage disease which causes cardiac involvement is Pompey's disease, which is a lysosomal storage disease due to defective acid maltase enzyme present in the lysosome. Right? So these are the various glycogen storage diseases and their enzyme deficiencies and its features. So you have to know what the diseases causing hypoglycemia, the diseases causing exercise intolerance, yes, the diseases causing cardiac involvement, hemolytic anemia, and which causes which does not cause hypoglycemia or exercise intolerance, instead causing hepatomegaly and muscle hypotonia alone. Right? So this is how you have to understand and memorize the glycogen storage diseases. So type 1 is, 1 goes with 1, von Geerk's disease, right? And Cory is rhymes with 3, so it is type 3, Cory's disease. C and D, so D branching enzyme deficiency is Cory's disease. Glucose 6 phosphatase deficiency is von Geerk's disease. So this everyone will be familiar, type 1. Then branching enzyme is A, B. So branching enzyme deficiency causes Anderson. It is next to the D branching enzyme, which is type 4. Then muscle phosphorylase, M for M, which is McArdle's disease. And liver phosphorylase rhymes with ver, rhymes with her, and it ends with yes, so it is type 6. So previously liver phosphorylase is type 6, muscle phosphorylase is type 5. And Taruvie's disease is type 7, which is due to phosphofructokinase deficiency. And left out is type 2, which is Pompey's, which is due as a lysosomal storage disorder also due to deficient acid maltase. Right? So these are the glycogen storage disorders. Hope it was useful. Thank you all.